Hi guys, welcome to my channel. My name is Femi Beatrice, and in today's video, I'm going to be talking about what you need to know before moving to a critical care unit or an intensive care unit as a nurse in the UK. There is a one-year foundation program designed for starters in the ICU. Doesn't matter if you're a fresh grad from uni or if you've worked in the ward for years. As long as you don't have any ICU experience in the UK, you'll be required to do this program. It's structured to help you settle in and function as an ICU nurse. It covers the anatomy and physiology of the major body systems, diseases that affect those body systems, especially those commonly found in the ICU. You learn about ventilators, ABGs, using the filter, and other critical care concepts that are essential for ICU nursing. I'm not sure if all ICUs in the UK operate the same, but when I started in the ICU, I had a 12-week supernumerary period. That was 3 months of not being counted in the numbers, working with my preceptor or any other ICU nurse. But no matter the duration, you will have your supernumerary period. That time is to get you adjusted and settled a bit in the ICU and allow you function on your own when you finally get added to the numbers. Alongside the foundation program, you'll be expected to complete competencies. Competencies are topics from the foundation program that you are doing. You'll be expected to talk about these topics with someone of a senior band role and sign them off. They might not just be topics, they might also be like skills from those topics that you're expected to learn. It could be like a band 5 also who has completed the foundation program, or a band 6 nurse and higher. Let me be real with you, there are a lot of competencies, so pace yourself. There's so much learning to do and so many trainings to book, especially if you're a new grad or you're coming from a medical ward like I did. So it can feel like you're starting from scratch. You'll have study days and training sessions on equipment you may have never used before, like PCA or PCEA pumps. It's a lot, so be kind to yourself and give yourself grace, especially if you're a new starter. Everything looks and feels different. The layout, the machines, the number of infusions, the patient monitoring, everything. You'll be dealing with more complex comorbidities than you're used to, and even cases of patients in general ICU might be a tad bit different from cases of patients in specialized ICU. So if you're a new grad or coming from the ward, it could be overwhelming. Like I said earlier, give yourself grace. You should know that it is a 1-to-1 care ratio, at most 1-to-2 care ratio. So 1 nurse to 1 patient ratio, especially if it's a level 3 patient, and then 1 nurse to 2 patients ratio if they are level 2 patients. Even the medicine preparation is at the bedside. You can't leave your patient alone without supervision. I feel like you have to be fixated on your patient as an ICU nurse, except maybe they are level 2 patients and you are very certain that they would be fine if you left them alone. This is one thing I dislike about the ICU though, but it is what it is. Many of the patients you come across will be sedated and ventilated. Still, introduce yourself, talk to them like they are awake. Let them know what you are doing, even if they are unconscious. Treat them with the same dignity you would if they were awake. Be prepared to stand and walk a lot. ICU shifts can be physically draining. Compression socks and a good pair of work shoes, absolute game changers. You should know that you'll be coming in contact with medications that you might never have come in contact with before, like propofol, fentanyl, atracurium, rocuronium, higher concentrations of potassium, and so on. Make sure Medusa is your best friend, or whatever IV administration software you use in your NHS trust is, because some medications, especially when they're IV, cannot be given through a peripheral line, only central lines, and you don't want to make a medication error. Due to the nature of the ICU, I would say there is more teamwork in the ICU than on the ward, and the doctors are always on standby. They are easily accessible, especially on night shifts, unlike in the ward. If you are transferring from another department, you should know that you might feel like a new grad again and learn to do even the simplest of tasks over again. For example, talking during ward rounds is something that you might have to practice again, just because it's a new range of disease you are dealing with and you might be unfamiliar with them. So practice with your preceptor around, practice talking to other members of the MDT like the doctors, the pharmacists, the physiotherapists, occupational therapists, dietitian, and so on. You might even have to learn how to talk to patients and their relatives, because with patients friends and relatives, you have to break down the big medical lingo into simple words. Not everyone knows what a ventilator is, and you have to break down this big machine into simple words for easy communication. So practice with your preceptor around, listen to other people talk, and adapt their communication style with yours. Asking the relatives things like, what would you like to know? Do you understand what's going on? Also, admit your limitations and seek help from your preceptor if you are stuck. Usually, if you are new in the ICU, you should be assigned to a preceptor and be on like a 1-year preceptorship program. In my case, I got to work with my preceptor a lot, especially during the supernumerary period. I would advise you to take advantage of a preceptorship period, asking for the difficult things or patients while you're on your preceptorship period, and make mistakes while you are on that period also. Learn how to admit, discharge the patients in order to build your confidence. Don't be afraid to ask a question. Also, sign a good amount of your competencies while on your preceptorship period or supernumerary period, because once you join the numbers, it's hard to get someone to sign in just because of how busy the ICU can get. I want you to know that it might take a long time before you feel confident on your own. It is okay that you're anxious. Like my line manager said, Fimi, give it a year. And I would say the same to you. If you are new in the ICU, give it a year. I would advise you to learn the routine of the ICU you work in. Know when it's time for rolls, huddle or SAM, ward rounds, and things like that. Note that rolls and personal hygiene are not played with in the ICU. Because of the nature of the kind of patients we have, they are very susceptible to pressure ulcers. So we are really keen on our 4-hourly rolls and even 2-hourly rolls as needed. I would advise you to form a good relationship with your colleagues, especially the ones you resume together with in the ICU, because you guys are probably going to be in the same foundation program and you can easily call each other for help. You should know that ICU nurses are more independent than ward nurses. So let's say, for example, things like electrolyte replacement. You don't need to wait for the doctor's permission to review or replace them. So, for example, on my units, when the patient is admitted, on the PRN section or on the continuous medication section, most of the electrolytes are already prescribed. So like your potassium, your magnesium, your phosphates. So if you go through the labs and ABG and you feel like they need topping up, top up according to your clinical judgments. You should also know that as an ICU nurse in the UK, judging from my trust, you're going to have a good knowledge of the ventilators, their modes and settings, because as an ICU nurse, you'll be making changes on the ventilator as per the patient's condition or ABG readings. And know that this is the point of the foundation program, to teach you these things. Unfortunately, you don't get paid extra for being an ICU nurse in the NHS. As long as you're a band 5 nurse, you get paid the same as other band 5s in the other areas. Sad, I know, but it is what it is. Find your own stress relief. For me, it's movies and shows. I'm currently watching Abbott Elementary and I'm loving it. Whether it's yoga, it's sleep, it's prayer, journaling, or family time, learn to make time for yourself and manage your own stress. Don't try to master everything in 1 month. Set achievable goals and realistic timelines for your growth. Otherwise, you're just going to burn out. Even if you were an ICU nurse back home, remember that this is a new unit in a new country. Every unit has its own way of doing things. Stay open, stay humble, and when you are settled in, then you can shine on your own way. Thank you so much for watching this video. I hope you found this video very helpful. Don't forget to like, leave a comment, or if you've got questions about the ICU, you can leave it down in the comment section below. And of course, subscribe to the channel and see you in the next video. Bye.